In this section, we're going to cover the Histories tab located on the pill bar. So when you select History, this is going to bring up your chronic conditions, your medical, surgical, interim, past medical history, diagnostics, family history, and social history. Some of the changes are chronic conditions and medical, surgical, interim history are side by side. Both of these still function the same, but now you have an add button instead of double clicking in the grids. So to add chronic conditions, you're going to select the add button. To add any past medical surgery information, you're going to select the add button. For diagnostics studies, again, you're going to select the add button. This was also demonstrated on how to add diagnostics in part 1 of the nurse intake video. To add family history, you're going to select the add button. It's going to bring up the family history template that is still relatively the same. One of the bigger changes is the social. Now to add social history, you have tabs to select from. So for the first tab, we select substance. Then we're going to select add. This will bring up the social history, tobacco, alcohol, and caffeine information. You would select what is necessary and move on, working down from the left navigation. So then you go to statuses, and again this opens up additional the employee information, marital status, and so forth. And we select lifestyle. This will have our lifestyle, sleeping patterns, home environment, safety, and so forth. Occupation, and this will have your employment information for that patient. And then comments. You can have additional comments that will appear in the social history. Once you've completed this, you will save and close. The confidential history section is now a button. You will select the confidential history information, and again you will work down from the left navigation. You have alcoholic, drug, psychiatric, abuse, incarceration, sexual practices, STDs, and provider comments that can be added into this section. And again, each section allows you to only print this on the document. So if you only want sexual practice STDs to print on the document, you would select this check mark, and this will place it on your master IM office visit document. It will not print the entire confidential history, just the section that you selected. When you are done, you will select OK. When you scroll up at the top, you notice that there's this history review. When you were done entering all of the medical past information on this patient, you will select history review, and from this template you will select detailed document for med surgery interim, detailed document for family, and detailed document for social. Save and close, and this will print on the intake note and on the provider's office visit note.